Preventing mother-to-child transmission of hepatitis B, strategies and importance. Worldwide, the most common route of transmission of hepatitis B is mother-to-child during birth. We call this vertical transmission, as well as through early childhood transmission, also known as horizontal transmission. These routes of hepatitis B virus transmission are also responsible for most chronic infections. Therefore, prevention of these infections from mother-to-child or early childhood transmission is the most important strategy to control the hepatitis B virus epidemic. Hepatitis B is spread mainly through exposure to various body fluids, including blood, saliva, menstrual, vaginal, and seminal fluids. Transmission can also result from unsafe injections and poor infection control practices during medical, surgical, and dental procedures, sexual transmission among men who have sex with men, and through unscreened blood donations. However, with appropriate interventions and preventive measures, the risk of mother-to-child transmission can be significantly reduced or even eliminated. In this video, we'll explore various strategies to prevent mother-to-child transmission of hepatitis B. Without intervention, between 70% to 90% of infants born to hepatitis B-positive mothers can become chronically infected, which significantly increases their risk of developing liver-related complications later in life. The question here is, how do we prevent this epidemic of hepatitis B that is primarily transmitted from mother to child? Let's make it simple by dividing the prevention of mother-to-child transmission of hepatitis B into 1. The care to be given to the mother during pregnancy to prevent mother-to-child transmission of hepatitis B, and 2. The care to be given to the baby after birth. Note that the exact method of preventing of mother-to-child transmission varies between countries, but the following is a summarized outline of what is involved. Usually the starting point is screening and testing for the pregnant women. Prenatal screening for hepatitis B is crucial for identifying infected mothers. All pregnant women should be screened for hepatitis B surface antigen during their first prenatal visit. If a woman tests positive for hepatitis B surface antigen, further testing is done to assess the level of viral replication, viral load, and liver function. This information helps in determining the risk of transmission and planning appropriate interventions. The next is antiviral therapy. For pregnant women with high viral loads, antiviral therapy with medications such as tenofovir or lamivudine may be recommended to reduce the risk of mother-to-child transmission. Antiviral treatment can lower the viral load, decreasing the likelihood of transmitting the virus to the baby during childbirth. Your doctor will, among other factors, consider which drug is best for you. Don't forget to subscribe and hit the notification bell so that you can get more from us. Another option given to the mothers during pregnancy to prevent mother-to-child transmission of hepatitis B is cesarean section. In some cases, a cesarean section C-section delivery may be recommended by your doctor to further reduce the risk of transmission, particularly when the mother has a high viral load or is hepatitis B enveloped antigen positive. Cesarean section can minimize the baby's exposure to infected blood and bodily fluids during childbirth, lowering the risk of transmission compared to vaginal delivery. Whether you have a vagina delivery or a cesarean section, a breastfeeding guidelines should be given. Breastfeeding is considered safe in most cases, as long as the infant receives appropriate immunoprophylaxis at birth. However, if the mother's nipples are cracked or bleeding, she should temporarily refrain from breastfeeding until the condition resolves to prevent potential transmission through breast milk. Note that during delivery special care must be taken to reduce the risk of transmission. Now let's go to the second part, which focuses on the care to be given to the baby after birth to prevent mother-to-child transmission of hepatitis B. First, the child must receive hepatitis B vaccination. One of the most effective ways to prevent mother-to-child transmission is through vaccination. Newborns should receive the hepatitis B vaccine within 12 hours of birth, followed by additional doses as per the recommended schedule of the country. The vaccine contains inactive hepatitis B virus particles, which stimulate the body's immune response to produce antibodies, providing protection against future infection. Another intervention is the use of hepatitis B immunoglobulin. In addition to the vaccine, newborns born to hepatitis B surface antigen positive mothers should also receive hepatitis B immunoglobulin within 12 hours of birth. Hepatitis B immunoglobulin contains antibodies against the hepatitis B virus, providing immediate, short-term protection to the infant while their immune system develops immunity from the vaccine. Please subscribe to our channel and hit the notification bell so that you can get more educating videos from us. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the links in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.